Picture this. You walk into a doctor's office, sit down, and hear those dreaded words, "You have a chronic illness." For millions of people, getting a diagnosis like type 2 diabetes isn't just a medical shock, it's a deeply personal threat. Right away, there's this overwhelming fear that you're going to have to completely give up everything you love to eat, drastically alter your entire lifestyle, and somehow magically find time in an already exhausting schedule to reinvent yourself. It's terrifying, but today we're going to look at how the right kind of communication can completely flip that experience on its head. Welcome to today's Explainer, where we're breaking down the exact anatomy of a clinical consultation to see how a doctor can transform a patient's fear into confident, sustainable action.
So this brings us to a really fundamental question. How do you actually give medical advice that patients will, actually follow? To answer this, we're diving into a super compelling case study from our source material. We meet Mr. Rajana. He's a 48-year-old shopkeeper who runs an urban provision store in India. He sits in his shop all day, frequently eats outside food, and let's be real, when you're working morning to night surrounded by easy-to-grab snacks, who wouldn't? Well, he's just been diagnosed with type 2 diabetes. He's tired, and frankly, he is terrified of losing his traditional foods. Facing him is Dr. Meera, a primary care physician who somehow has to get Mr. Rajana to change his life without totally scaring him away.
Here is our roadmap for today. We'll cover the consultation challenge, asking before advising, the Indian plate method, setting smart lifestyle goals, the teach-back method, and finally, putting together a collaborative action plan. Let's jump right in and break down exactly why this approach works so well.
Okay, Part 1. The Consultation Challenge, Understanding the Patient's Reality.
Just listen to Mr. Rajana's exact words here. He explicitly says he's worried about stopping rice completely, and he points out that he runs his shop from morning until night, leaving him absolutely no idea when he could possibly exercise. These are incredibly relatable struggles, right? He isn't trying to be difficult, he's just being completely honest about his daily survival. If the doctor ignores this reality and just hands him some generic printout of a diet, she's already lost him.
Moving to Section 2. Asking before advising, the power of empathy and exploration.
Now, instead of just launching into a lecture, which, let's face it, risks blaming or shaming the patient, Dr. Meera uses a technique called motivational interviewing. She asks a really crucial question. Could you tell me what worries you most about diabetes? By asking about his current diet first, she discovers that his day is basically fueled by sweet tea, idli, rice with sambar, and shop snacks like biscuits and bhaji. She gathers the actual data she needs to suggest practical changes, while at the exact same time showing Mr. Rajana that she genuinely cares about his specific day-to-day life.
Section 3. The Indian plate method, visualizing a balanced diet.
So how does she handle the food issue? She introduces this brilliant, highly visual tool, a stainless steel plate conceptually divided into manageable portions. Half the plate is dedicated to non-starchy vegetables like leafy greens or vegetable sambar. 1/4 is for cereals, which is where his beloved rice, chapati, or ragi goes. And the final quarter is for protein like dal, eggs, or lean chicken. This is a massive psychological relief for him. Instead of outright banning his traditional foods, she shows him he can absolutely still enjoy his rice and familiar meals. He just has to control the portion size and balance it out. She literally takes the anxiety right out of the equation. Then, rather than handing him a one-size-fits-all plan, she gives him highly practical guidelines tailored to exactly what he's already eating. Swap those bakery biscuits for roasted chana, use a slightly smaller serving for his rice, reduce the added sugar in his tea, and try not to skip meals unnecessarily. She proves right here that a medical diet plan must realistically fit a patient's family, culture, and budget. Otherwise, it's pretty much entirely useless.
All right, Section 4. Setting smart lifestyle goals, small steps for a busy shopkeeper.
Transforming broad medical concepts into actual, manageable steps is where the magic really happens. Dr. Meera doesn't just dictate from on high. She negotiates these SMART goals, specific, measurable, achievable, relevant, and time-bound, directly with him. For his diet, he chooses to stop adding sugar to his evening tea and swap out his snacks. For exercise, he agrees to walk 15 minutes after closing up the shop. And for medication, he's going to use a phone alarm. By letting the patient choose these specific actions, Dr. Meera empowers him. She isn't demanding sweeping, impossible life overhauls. She is actively partnering with him to make changes he truly believes he can pull off.
Now, the medical standard is pretty clear. Adults with diabetes should aim for at least 150 minutes of moderate physical activity every single week. But throwing that giant number at a tired, sedentary man who works all day, that's incredibly intimidating. So Dr. Mira wisely starts him at just 10 to 15 minutes of walking after he closes his shop. This incremental approach is the absolute heartbeat of effective lifestyle counseling. You have to meet the patient where they are, not where the textbook says they should eventually be.
Section 5. The teach-back method. Confirming understanding, not testing the patient.
To prevent dangerous medical misunderstandings, there's this great tool called the teach-back method. The clinician simply asks the patient to explain the plan back to them in their own words. But the secret sauce here is in the framing. Dr. Mira says, to make sure that I explain them clearly, could you tell me what you plan to do from tomorrow? Notice that? She puts the burden of clarity entirely on herself. It's a non-punitive strategy that ensures she did a good job explaining things respectfully. It's not a pop quiz for the patient.
Notice the total shift in his tone here during his teachback. He rattles off his diet changes, his exercise plan, and his medication strategy flawlessly. This is a stark contrast to his initial worries and fears at the very start of the consultation. He owns this plan now simply because he helped build it.
But Dr. Mira goes even further. She uses contingency planning. She asks him which of these might be difficult. When he admits that walking might be really tough on his busy shop days, she asks for an alternative. They agree he can just walk around inside the shop in shorter bursts to break up all that sitting. This is such a brilliant strategy for anyone trying to build a habit. By anticipating the obstacles and basically planning for failure with a backup plan ready to go, she ensures a single bad day doesn't completely derail his entire health journey.
Section 6. A collaborative action plan, the blueprint for success.
At the end of it all, Mr. Rahana leaves the clinic with a super simple 7-point written action plan. It's affordable, it's culturally appropriate, and most importantly, it is deeply collaborative. Every single item on this list is a direct result of that motivational interviewing we talked about. It proves that when doctors avoid shaming and instead focus on specific, achievable goals tied to a patient's actual daily routine, the chances of them sticking to the plan absolutely skyrocket.
As we wrap up this explainer, I really want to leave you with this final thought. Think about the conversations you have in your own life. Whether you're a healthcare professional guiding a patient, a manager leading a team, or just someone trying to support a family member through a tough lifestyle change, the very next time you need someone to change their behavior, ask yourself, are you just lecturing them? Are you actually partnering with them? Thank you so much for joining me to explore the profound impact of structured, empathetic communication. Keep learning, and I'll catch you next time.